Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Gastric carcinoma, we're dealing with the Lawrence classification. So here, first we look at the intestinal type and then we'll compare it to the diffuse type. So when we're dealing with the intestinal type, it is nothing but the type 1. Intestinal means it is type 1. So intestinal, it is environmental. Next, there is presence of the gastric atrophy. So there is the gastric atrophy is present, and there is also the intestinal metaplasia, which is seen. And in terms of intestinal, the men is greater compared to the women. There is a significant increase in the incidence with age. The significant increase with the incidence of age. There is also the presence of the gland formation. So there is presence of the gland formation, and there is a presence of the hematogenous spread. So this hematogenous spread is seen, as well as there is a microsatellite instability. There is presence of the microsatellite instability and also the APC gene mutations. APC gene mutation. Next is the presence of the TP53 as well as TP16 inactivation. So to recap a few points, there is a gland formation, hematogenous spread, this is microsatellite instability, this is APC gene mutation as well as the P53 inactivation. Now we look at the diffuse type, that is the diffuse of the type 2. So if you look at the diffuse or the type 2, so diffuse of the type 2. So in intestinal or type 1 it was environmental, here it is going to be familial. So here it is nothing but it is familial, and it involves the group A. So blood type is A, and here in diffuse type it is going to be the women. So women is greater than the men, and this involves a younger age group. So it involves a younger age group. Next is there is differentiation, that is there is poor differentiation. There's poor differentiation as well as this presence of the signet ring. So the presence of the signet ring cells. Next is there is presence of the transmural. There's presence of the transmural or the lymphatic spread. Transmural or the lymphatic spread is present. Then there is a presence of the decreased E cadherin. So there's decreased E cadherin, and then there is a P53. There's presence of P53 or P16. This is inactivation. So P53 and P16 inactivation, and the decrease in the E cadherin is seen. To learn and grow daily like this, please do subscribe.